to wait for a few more people to hop on in. In the meantime, if you have any questions throughout this, you can feel free to raise your hand and ask them yourself, or you can pop them in the chat box and I can read them out for you. Really quickly, before we dive in, for those of you who are new to either Yinova or Jill, I wanted to let you know a little bit about us. The Yinova Center is an acupuncture and Chinese medicine clinic based in New York City. We specialize in fertility, women's health, and reproductive care. As of recently, we've moved part of our practice online and have been offering virtual consultations to support our patients, and we actually opened our clinical doors today. I'm going to pass this over to Yinova founder Jill Blakeway to introduce herself, and then we can get started.
Well, hello. It's lovely to see you virtually. I'm Jill Blakeway, and I'm the founder of Yinova. And it's true, we did. We opened back up today, which was we kept all of our team employed because they're a very skilled team indeed, and very valuable to Yinova. And we are back at work, but we're going to do a bit of virtual still and some in clinic for the fertility patients, particularly who need us. And I think today's topic is acupuncture and IVF, Emma. And I wanted to talk a little bit first about how acupuncture works, because I think we know more these days than we used to. And what's interesting about acupuncture is that acupuncture points themselves are identifiable on MRI. I wrote about this in my book, Energy Medicine. But you can see the acupuncture points on MRI. They look different to other parts of the body. And the question has always been, why? Why do we have these slightly specialized tissue? And the answer, it turns out, lies in embryology. When an embryo creates itself in the womb, it does so electrically. And there's a wonderful video called Electric Frog Face from Tufts University that shows a frog embryo doing just that. It's like lightning going across its face. And the embryo creates nodes, and those nodes have a greater sort of ability to transmit electrically, and they signal the budding off of the next bit of the embryo. So for instance, they create one in the elbow here, and that buds off the forearm. And it turns out that if you overlay a map of the major acupuncture points on those embryological nodes, what you end up with is they're in the same place. So it would appear that this electroconductive tissue that is used to build us can still be used to regulate us. And when it comes to fertility medicine, we use acupuncture to move blood, promote circulation to the follicles to resource a really good egg, and also to the uterus to help with uterine lining. We can use acupuncture needles to balance hormones, particularly reproductive hormones, and there is clinical research that backs this up. As many people know, acupuncture increases the efficacy of IVF. The first study that was done on that was done in the early 2000s by someone called Paulus. It was published, and they took 180 women going through IVF and gave half of them acupuncture with their IVF and half didn't. And the half that had acupuncture had a 50% better outcome. So in general, it's very supportive. The clinical research I like, though, is a study that's done by someone who's a friend of mine, Dr. Lee Hollander, and she did a meta-analysis where she looked back at loads and loads of IVF. So it was a sample size of well over 1,000 women going through IVF. And what she found was that having acupuncture around the IVF procedure, particularly around transfer, increased pregnancy rates. But what really increased live birth rates was having acupuncture and what's called whole systems Chinese medicine, everything that we do, in the 3 months before the procedure. So we like a bit of time to get people in shape to have IVF if we can. Obviously, if we can't, we'll just see people where we can and help them however we can. But it turns out that whole systems Chinese medicine, which is dietary advice, lifestyle adjustments, moxa, Chinese herbs, supplementation, exercises, all of those things potentiate. They're all part of Chinese medicine, and they potentiate the IVF, and they dramatically increase the live birth rates. We have that study on our website, on our Yinova blog, and actually Lee Hollander wrote us a very nice article about it, if I remember rightly, Emma. So I am wondering if you have questions from people at home.
I do. Before the event, we asked our social media for some questions, and someone wrote to us wondering, she said, I'm 35 and still haven't found someone that I want to settle down with. Have I left it too late? And do you think I should start to think about freezing my eggs? A bit of a tricky one.
You haven't left it too late. We're New York acupuncturists, and most of our patients are trying to get pregnant in their late 30s and early 40s, and we have very good success rates, not just us, but combining it with assisted reproductive techniques. So fear not, panic not. I know that reproductive medicine makes you feel old. Having said that, freezing your eggs is a very personal decision. It costs, a reasonable amount of money, significant amount of money, and it is, a procedure that requires, that is taxing for your body. But I, just as a woman, and as a practitioner who's talked to patients I've done this for over 20 years, all those years, I actually think it's a really good technology. It's got better and better. When I was first in practice, egg freezing technology wasn't that great. They were better at freezing embryos than they were at eggs. And so their fertilization rate when they defrosted them was not particularly good. However, the technology has come on hugely in the last 5 years. I think it's a nice insurance policy. I always say to my patients, it stops you from settling for Mr. Wrong. Because you think your biological clock is ticking. It's sort of an insurance policy, and 35 is a very good age to do it. And my advice is to pick a center which is proven. There are a lot of egg freezing centers out there, but find somewhere that has had live births from their eggs. So that just makes sense, really, I think, so that you can see their success rate, which isn't how many they freeze, it's how many come out the other end and are viable. But yeah, I actually think it's a good technology. And just to explain people what egg freezing entails, you do half an IVF, really. You're given the follicle stimulating drugs. We do acupuncture to help potentiate them. And then you do a retrieval that gives you plenty of follicles and therefore plenty of eggs, hopefully. And then you do a retrieval and those eggs are frozen and then your work is done. Although most people go through more than one round of egg freezing. So you possibly start again and we go through the whole thing again. And then you just leave them in the freezer till you need them. And they don't deteriorate. So I think it's a good technology. Next question, Emma. Thank you.
That was really interesting. Sorry, just checking I'm not on mute. So we had another question, which was a little more vague, but I think will be helpful to get some clarity on. And they were wondering, what exactly is an IUI and how do I know if I need one?
Oh, it's a good question, actually, and it's not too vague at all because an IUI is what used to be called artificial insemination and is now called intrauterine insemination. And what it means is that the sperm is taken and washed and condensed, and then it is placed at the appropriate moment into the uterus via a catheter. And usually there are lots of different ways of doing an IUI. You can do a natural cycle where you don't take any fertility drugs at all, and they just do the IUI. It is normal, though, to trigger ovulation. And they give a pharmaceutical called Ovidril, and it triggers ovulation, and that helps them time the IUI perfectly. And one of the issues that stops people from getting pregnant is actually good timing. it's harder to time these things than it looks like it would be. So that timing, that very perfect timing, is really helpful. The condensed sperm is semen is really helpful. The washed semen also ups your chances, and it also bypasses cervical mucus. And women produce fertile cervical mucus when we ovulate. It's actually, I know I get very enthusiastic about this kind of thing, but reproduction is my topic. It's the only time we become the same pH as semen. I mean, we become accommodating, but only for a couple of days a month, which is, I don't know, kind of genius. We're remarkable. Human beings are extraordinary. That fertile cervical mucus is really important for sperm to survive. It has little striations in it that help them to swim along. It has nutrition for the journey, and it can keep them alive for several days. A lot of women do not necessarily have enough cervical mucus. It's one of the things that we give people herbs for at Yinova, or they have cervical mucus which is too acidic. The term is hostile cervical mucus, which I don't know, I always shy away from because it sounds like it has teeth or something. But if you do have cervical mucus that's too acidic, one way of solving that issue or bypassing it is to do an IUI. So the IUI gets timing right. It bypasses any kind of cervical mucus issue, and it concentrates the sperm a little bit. They sometimes do IUIs with fertility drugs. They have to be careful, because if they gave you the same fertility drugs as they do when they're doing IVF, when they're collecting the eggs and fertilizing them outside the womb, you can have a high risk of multiples. So, but they're very good at this, the IVF doctors and the fertility doctors, and they give just a small amount of Clomid or Letrozole, which is taken orally, not by injection. And that in people who have poor egg quality as they get older, that means they can have 2 eggs instead of 1. And the hope is that one of them will pan out. It's like 2 tickets to the lottery instead of 1, in a way. So there are many reasons to do an IUI if you've been struggling to conceive on your own. And we back people up with acupuncture and with Chinese herbs around IUI all the time. It's really what we do all day.
That leads me into the next question, actually, which was someone who was wondering, how long should they try naturally before considering ART?
Well, it depends on your age, really. So if you're in your early 30s or your 20s, then a year, if you're in your 20s, they often advise a couple of years. I actually am one of those people who think you should go and have some testing early on and not just plug away. Because can you imagine if we were giving you acupuncture and herbs and it turned out you had blocked tubes, and we'd all, you'd wasted your money and your time. So I do refer people to a fertility doctor for basic fertility testing. And if everything tests okay, I think a year is perfectly reasonable. You have to think that not every month is a winner for reasons that aren't in any way pathological. To give you an example, sometimes the little hairs at the end of the fallopian tubes, they're supposed to sweep the egg down the tube. And some months they just sweep it to one side. And that really isn't a pathology. It's just sort of the luck of the draw. But you don't know that month isn't a winner, but it isn't. Or sometimes you get a fertilized egg, an embryo, and it doesn't implant because it lands on a bit of mucousy tissue in the uterus. And again, that's not really, unless all of your tissue is mucousy, in which case we have herbs for that. That is not really pathology. That's just bad luck. So say you have a normal cycle of 28 days, that gives you 12 chances to get pregnant in a year. A few of those won't be real chances. You can see that it takes a bit of time. And the statistic is that if you're in peak fertility, it should take you, you have a 25% chance of getting pregnant every month. So that should take you 4 months. Throw in an extra 2 for, you know, bad timing or near misses and things like that. So as you get older, that goes down. So a year is perfectly reasonable. But I would have fertility testing and make sure that there's nothing obvious wrong fairly early on, so that you're not just plugging away when really you need help sooner.
I think that's really helpful advice. Someone was wondering how long they should rest post-transfer. Is there a set amount of time or some advice for post-transfer?
Yes. Yes. Well, the first thing is I do like people to rest post-transfer, but there is some research that shows that people who just go to bed and do absolutely nothing have slightly lower implantation rates. And that makes sense because you do need some blood circulation. Yeah. So, you know, sometimes people feel like they just need to lie flat for several days. That isn't necessarily helpful. So what I usually say to people is you need to divert your body's energy away from daily living and to implantation. And that means kind of puttering gently. So, you know, you can wander to the deli and pick up a snack. Well, not now, but as we come out of our lockdown, you could wander to the deli and pick up a snack. You can go for a sort of gentle walk in the park. We're not talking about just being immobile, but I do think the day of transfer, you just go home and put your feet up and hopefully have someone there who can, you know, bring you things like cups of tea, and you can read magazines and watch Netflix. And then the next day you could just putter gently. And then the day after that, you can, you know, just go back to your normal routine. Although I wouldn't exercise at that point. Or, you know, not just yet. I'd wait until a positive pregnancy test.
Someone was wondering if they're starting a new cycle of IVF, if they should come in for acupuncture or not, specifically in the context of this pandemic.
Yes. There's a lot we can do virtually. You know, and I talked about whole systems Chinese medicine when we first started talking. And, you know, there is whole systems Chinese medicine means all the ways that we use the wisdom of Chinese medicine to give you advice and support you, including providing herbs. And we can do all of that virtually. And the Yinova team, we've all been working really hard, actually. We've seen a load of patients, and we're doing just that. But the acupuncture around the IVF is actually important. And that is not so easy for us to offer you virtually. Now, during the sort of major lockdown, we improvised. We are a bunch of very creative and innovative women and men, and we got out there and we sent moxa sticks to our patients, and we had the moxa acupuncture points and do acupressure, and we did guided meditations where we guided their minds to move chi and things like that. But nothing quite replaces the needles at that point. And in fact, the reason that we have opened up and been declared essential is because of our support of fertility patients going through IVF, and because it's provable that we increase the efficacy of IVF, you know, quite considerably. So at the moment, it is safe to come in and see us. We're all wearing personal protective equipment. We're taking one patient every 30 minutes, so they're not meeting each other. We're doing our consult part of the treatment online, so to minimize the amount of talking and interacting we do, which is a shame because we do like chatting with our patients, and but we do it online. And then the actual acupuncture, we're always doing acupuncture in a very sterile manner anyway, but we're wearing gloves and masks, and it's safe to do it. So yes, if you are doing IVF, I would encourage you to come in, and if you have any concerns about that, I would encourage you to talk to us. You know, we can have a virtual consultation and we can talk you through what we will do and how we will keep you and everybody safe in what is a very difficult time to have to do IVF.
Thank you. That's super helpful. I think we just have one more question before we start to wrap up. And if anyone else has any other questions they want to pop in the chat box, I can read those out loud. But someone wanted to know, while staying at home, if you had any advice for optimizing your fertility from home. I feel like we've touched a little bit on the virtuals, but if there's any other advice as well.
Well, I wrote a book called Making Babies, and I don't mean to plug my own book, but it was all the things I wanted patients to know that I didn't have hours and hours and hours to sit down and tell them. It is a bestseller for that reason, because I combined what I know from experience and what the Yinova team know from experience with the experience of a doctor. And following the program in the book basically divides people into 5 different types, and there is a 3-month program for your type. And that is really helpful. But you don't have to buy the book at all. You can have a virtual consult with us, and we'll diagnose you and talk you through it. The important thing to know, though, is that there isn't one size fits all for a fertility issue. The reasons people aren't getting pregnant are very varied. And you know what the skill of our job is in our detective work and how we work out what's happening and troubleshoot it. But I would suggest this. I would suggest doing a basal body temperature chart. There's you can read about them in Making Babies. There's also a really good book by Tony Wexler called Taking Charge of Your Fertility, which will teach you more than you ever knew you needed to know about how to understand your body's rhythms. I would suggest getting really good at understanding your own personal rhythm. And a basal body temperature chart doesn't just tell you when you ovulate, it shows what your hormones do all the way through your cycle, and it's really illuminating. And from my point of view as a practitioner, then when I see that, I can prescribe herbs to help. So I would do that. And then your diet, you'll find all sorts of draconian fertility diets online. And I always tell people you have to come up with something you can actually do for a length of time. Like anyone can do anything for 10 days, but you know, you may do this for 3 months, or even longer. So it has to be something that accommodates the occasional cheat day and your real life, a cocktail here and there. So I am not a fan of draconian fertility diets, but I do think that the people who find it hard to get pregnant are the people who are missing a nutrient. So people who don't have enough healthy fats have trouble getting pregnant, because you do need fats to make reproductive hormones. People who only live on protein and don't have any carbohydrates often have trouble getting pregnant too. So some kind of sensible diet that prioritizes good quality lean protein, animal protein if you do it, otherwise non-estrogenic protein sources if you're a vegetarian. That means beans and legumes. Tempeh is okay because it's fermented, but tofu can be problematic when it comes to fertility. Soy milk can also be problematic. So some good quality protein, lots and lots of colorful vegetables. Like make a rainbow on your plate, basically. And what I like to do is cut all those up at the beginning of the week on a Sunday and have them all in little Tupperware in the fridge, and then you can make yourself a salad and put sardines on it or something like that, and that'd be really good for you. And lots of leafy greens, kale, broccoli, chard, cabbage, things like that, and some high quality fats. Avocados, salmon are good, nuts are good, olive oil, coconut oil, and that's about it.
That's super interesting too. Thank you. I think those are all of the questions for today. I want to thank you for sharing your wisdom with us. That was super helpful, and we'll share this video with our community too, so that they can glean some insight from your wisdom.
Well, you're very kind. You're too kind, really. I'm happy to chat about, as you can tell, I'm very happy to chat about this at any point. And if anyone would like to chat with us further, we are available online. We also have fertility coaching groups. We have one on the go at the moment. That's an 8-week course. We also have one just about to start up, and they're really worth doing. Senior members of the Yinova team with tons of experience are taking small groups of women through the 3-month program in Making Babies online. We've made it very reasonable price-wise to help people, and it's a combination of coaching and support from people going through the same thing. And the people going through the group at the moment tell me they love it, that they love their group leaders, and they also love the women that they're in the group with. So there are many opportunities to interact with us, and we would welcome you with open arms, because helping people get pregnant is not just our job, but is what we love to do. So which is why we're chatting about it in an evening on Zoom. All right, you guys. Well, thank you so much for listening, and I will see you again. Take care.